Okay, go ahead, Carlos.
Okay, our vulnerable population are foster children, and our group consists of Dominic, Alexis, Charlene, Alejandra, and myself, Carlos. Okay, this is what we're going to be talking about. Okay, now for a quick overview of foster children. A foster child is someone who is under the age of 18 and is being cared for by state authorized caregivers. Foster care serves as a temporary arrangement to protect children whose biological parents, for whatever reason, were unable to fulfill their role as a parent. And its purpose is to give children a safe and stable household in which they can remain until they are either adopted or age out of the system. When discussing the demographics, the bar graph in the top left lets us know that almost half of the children in foster care are non-Hispanic whites, as seen by the 43%. However, it is important to mention that even though Black children only represent 14% of the total child population, they represent 23% of the children in foster care, which is very concerning. In terms of age, the majority of children in the United States are within the age group of 1 to 5 years of age, which is followed by the age groups of 5 to 10 and 11 to 15, which combine for a total 44% of the foster population. Lastly, when looking at the statistics by gender, males have had a very minimal edge over females throughout the years. In the United States, about 400,000 children live in foster care, with approximately 30,000 of those living in the state of Texas, making it the state with the second highest foster child population, only behind California. And then about 200,000 children under the age of 18 have entered the US foster care system in 2020, which is a rate of 3 per 1,000 children.
Now moving on to vulnerability. What makes foster children vulnerable? When looking at what makes them vulnerable, we have certain aspects such as lack of education, transitioning into adulthood, oppression, powerlessness, mental health prevalence, and lack of foster care orientation. In what ways are foster care children and foster children vulnerable? Foster children are more likely to be victims of neglect and abuse, and are more prevalent when it comes to mental health problems such as depression, anxiety, and or PTSD. They also deal with lack of education, with only half of foster children graduating high school or getting a GED. And out of those 50%, 89% of foster children get a GED over just going to high school, and only 1.8% continue on into post-secondary education. They're also not given proper support in order to help them transition to adulthood. And as we see, a lot of past foster children are found to have no insurance, they have difficulty keeping a job, or they have mental and or emotional problems that stop them from functioning productively and independently in society. Now moving on to health-related issues. What we see relevant social determinants of health, we'll see that some things such as education access and the quality of that education, economic stability, healthcare access and quality, and social and community context. What health problems do foster children face? We see social problems usually due to lack of development in the social settings that they're put into. PTSD, usually from traumatic experiences or abuse experienced during childhood. Anxiety, which is usually a result of a lack of development, and stigma that happens with being a foster care child. And depression, which usually accompanies with the PTSD and has the same reasonings as behind it. Now, what are the key contributors to this? We see a lack of accountability from foster care workers on helping foster kids adapt to the new environment. Foster children are usually just thrown into the environment and expected to develop on their own. We see constant neglect and abuse towards foster children. We see a stigma and lack of encounters of foster children in the outside world, such as school, or maybe just like in the regular everyday life. And we see a lack of acknowledgement of the experiences of being a foster care child and not having a family, what that's like.
So moving on to health service needs and realities. Okay, the biggest issue is that these children often come into the foster care system due to abuse or neglect, and so that makes them more vulnerable and leaves them to more needing more medical attention. So on the left, we have the different services that these foster children may utilize: therapeutic supportive care, medical equipment, therapy, and mental services. On the right, we have a diagram showing the difference between foster care, children in foster care versus children who just use behavioral services. You can see that the children in foster care use more, meaning higher costs. And then finally, where do they receive care? These are just two of the options: emergency shelters and psychiatric hospitals. They can receive care anywhere, but these can be more prevalent. And then the different barriers to receiving care. So there's greater cost and utilization for children in foster care in comparison to children receiving medical assistance coverage. Number two, Medicaid. Not all healthcare facilities accept Medicaid. And then number three, signs and symptoms can be ignored by social workers or foster parents. So leading to a lot of neglect, and medical attention is often not received. And the little statistics down here says the prevalence of around $3,000 in comparison to dependent children who do receive aid only being around $500. And then what harms can a healthcare provider cause to this population? Foster children experience psychological difficulties that can lead to fear of unknown and being in an unfamiliar setting, meaning that they can be uncomfortable in a healthcare setting. And then incomplete or inadequate health information. So this means family histories, dental worker surgeries, these can often be not identified, which can lead to inadequate health assessments. And then point number three, misdiagnosis, overlooked symptoms, and inadequate medical equipment, meaning that observations can often be missed, such as simple things like asthma and anxiety, often up to like mental illness or brain injury. And then what can healthcare providers do to demonstrate sensitivity to this group? We need to improve the overall care. So just by more planned preventative and palliative care, often just to support the child's needs. Immediate pediatric health assessments when they are moving from home to home. These assessments can often be ignored. Expansion of requirements to include trauma-informed components and knowledge on social work because of these kids often coming into these homes with trauma or abuse. More healthcare provider participation to increase communication. Telemedicine should also be something that these children can receive just so they have more active monitoring, especially with mental health services. And lastly, provide foster families with education on developmental disabilities, complex medical conditions, and mental health conditions.
Okay, now into financial issues. A financial issue that many foster children face is a lack of financial literacy. In a study done, those that were 18 and up were more financially literate than those that were younger than them, but they still lacked key skills such as opening a checking account, building up savings, and establishing a credit history. This is due to the fact that financial capability and adult support are closely related, and many foster children lack that consistent adult support because they get most of it from caseworkers and independent living workers. They also experience a lack of employment and job training. These limited work histories ultimately lead to difficulty in finding employment as a teenager, but also in the future with an adult job. And those who found employment often find jobs that are more low paying, which make them susceptible to exploitation, poverty, and an increased difficulty in establishing independence. Many foster children obviously also experience unstable housing and homelessness, with foster children being placed in different foster homes. Most of them are moved 3 times over the course of their placement. And it is also important to point out that LGBTQ youth are overrepresented in these populations, with 30.4% in foster care, 25.3% in unstable housing identify as LGBTQ+. They also have, as mentioned before, limited access to healthcare and insurance, with very few providers accepting Medicaid, and also foster children having needs and specialties that are more substantial and complex, all of which are rooted in trauma.
And here are some of the ethical issues that relate to foster children. So some key terms to keep in mind are beneficence, which is the greatest good for the patient, non-malfeasance, minimizing the harm done. Justice is related to ensuring equitable care for children of different backgrounds. Autonomy is making sure that the child has the ability to make decisions regarding their care. And veracity is ensuring the accuracy of the information presented to patients. And some issues related to that. So with autonomy, it's important to make sure that these children have a say in the treatment that they're receiving. So making sure they have informed consent. Do they know what is going to happen? Like, do they have an idea of the side effects that could happen? And then with non-malfeasance, you want to make sure that it's congruent with practice. What happens if you observe any signs of abuse or if the child is uncomfortable? You want to make sure that no extra harm is going to be done to the patient who's already seeking for help. And then with justice, you want to make sure that care is able to be provided despite a difference in the availability of resources. So how do you work with a child who is belonging to a system that has no flaws, with whether it's disparities related to socioeconomic status or race or anything like that? And then with veracity, it's important to make sure that this is still maintained, because it can be challenging because there might be a lack in family history. There might be multiple providers, so it can be hard to document, which might result into certain errors being made. And with beneficence, you want to make sure that the child's health is properly maintained. So can you communicate necessary information for the child to know in a way that they can understand? Are there any language barriers that need to be overcome, and anything like that?
Okay, now we're going to take a look at some of the legal issues. Okay, a law that protects this population is the Adoption and Safe Families Act of 1997, which advocated for the need of more attention to be placed on the safety, permanency, and well-being of foster children. It was passed with the purpose of speeding up the placement of children in the foster care system. And then it is also important to mention that it established adoption incentive payments for states in order to increase the number of children adopted from foster care. Another law is the Foster Children Bill of Rights, whose purpose is to inform children about why they have been placed in foster care, as well as some of the rights they have within the system, which include access to food, shelter, and an education. And then it also lets them know what to expect moving forward. Okay, a law that harms this population is the Family First Prevention Services Act. The purpose of this law was to keep families together by setting more money aside to make a variety of services available, such as home parenting classes, mental health counseling, and substance abuse treatment. Although the intentions behind the signing of this law were good, it had multiple negative effects on the foster child population, with those being that funds and services are only made available following the case of significant abuse and neglect, meaning that it does not prevent child abuse and neglect from happening in the first place. This law also sets federal funding limits for group homes, and only under certain conditions, such as a teen who is pregnant or parenting, will the government pay for a child to stay in a group home for more than 2 weeks. And then lastly, kinship caregivers are no longer eligible to receive foster care payments, which makes it more difficult for extended family members to raise their children. With regards to legislative reform to help this population, I believe we should help biological parents by providing resources and services to them that can help keep their families together. Many of the parents who have their children taken away still love and care for their children, but are in the middle of a crisis in which they lack support and access to resources and services. And by helping them out, we can avoid the trauma that comes with separating families. We should also place more attention on supporting those who age out of the foster care system in order to combat the high rates of homelessness and incarceration within the group. And then lastly, we should spend more time and resources into training foster parents and educating them on how to meet the specific needs and concerns of foster children, which can be a difficult task considering the fact that many of them have been abused, neglected, or abandoned.
And now on to social issues. Foster children experience a lot of stereotypes that result from the abuse and neglect they experience in these foster homes. Stereotypes include being troubled, being addicted to drugs or other substances, being runaways, teen parents, being juvenile delinquents, being educationally behind, having a lack of trust for adults, and suffering from mental health and other emotional problems. There's also a stigma that surrounds them that's related to not living with their birth parents. A lot of foster children do internalize this stigma, according to a study, and experience higher rates of bullying than other children. Other social issues include having mental health issues in relation to a lack of self-worth, and also having a lack of social connections and permanent relationships, particularly those with adults.
And lastly, we have some considerations for nurses treating foster children. So what are some tips that you would give a nurse regarding how to sensitively provide care for foster children? So it's important to consider that they might have limited access to resources. It's important to be attentive to body language and social cues because some of them may have faced significant trauma, and it's important to make them feel comfortable because the hospital system can be a little intimidating, being in a large room with some strangers that the child doesn't know. And it's also important not to assume that the parents are not knowledgeable about the child's health or history. And there are some ethical dilemmas that the nurse might face when they work with foster children. So for example, they need to be able to identify signs of abuse during physical exams. So what do you do after that? Making sure that informed consent is there for youth and all the parties involved. But by doing so, it can lead to issues with the range of confidentiality, because since there are so many parties involved, how do you make sure that confidentiality is still kept when you have caseworkers, the foster family, Medicaid, welfare agencies, all of that involved in treating the child? And with discrepancies between the healthcare received between children of color and white children, that is also an issue, and there can be financial limitations for the child. So how do you pay for clinicians? How do you reimburse them when certain sources are inadequate? And these are references.